Hi, I'm Bill Cartwright, President of the National Retiree Legislative Network, the NRLN, and the American Retiree Education Foundation, the AREF. And I'm your host for our 2022 podcast series titled Creating a Better Life for Retirees, brought to you by millions of retirees from over 400 U.S. companies, private and public organizations, and individuals that I and NRLN volunteers work for every day. You can link to our videos and podcasts from the NRLN homepage at nrln.org. Look for us on our website, Facebook, YouTube, and Instagram to see the scheduled dates for upcoming series episodes. You'll learn current facts and hear from guest speakers about the political power plays to end Medicare by 2030, and learn how many in Congress want to strip Social Security eligibility and benefits. Learn the latest about pension reform and hear more about lowering prescription drug prices, as well as other topics affecting all seniors over age 50. Send us emails at contact@nrln.org or phone us at 866-360-7197 to ask us questions, offer comments, suggest topics of interest that you want us to talk about on future episodes. So I hope you'll find today's episode informative and useful. Thank you very much for your time and enjoy the episode. Welcome. I'm Bill Cartwright, President of the NRLN and your podcast host today. The subject of this podcast, episode number 2 for 2022, is denial of access to Medicare supplemental plan premiums. If we're able to get Congress and the Center for Medicare and Medicare Services, CMS, to change the rules for shopping for Medigap plans, it could save you hundreds, maybe even $1,000 a year or more in premium payments. To do that, we've gathered a group of 3 folks to help me and get through this subject. So I want to introduce our guests today. They're Ed Beltram. Ed is the NRLN and AREF Vice President of Communications. Ed's a graduate of the Universities of Oklahoma and Oklahoma State, and he spent his early career as a newspaper journalist, then 30 years as a corporate executive in media relations, public affairs, and human resources before retiring. Jim Bodenner is the president of NRLN's Florida Villages chapter and an attorney. He and his wife Susan owned the 47-bed Bishop Hills Elder Care Community in Rockford, Michigan, before they retired to Florida in 2012. Bonnie Burns is our subject matter expert today and is currently a consultant to the California Health Advocates and the SHIP Resource Center in California. She served as a consumer representative to the National Association of Insurance Commissioners, NAIC, for many years. She served on the congressionally mandated work group of the NAIC to develop the 10 standard Medigap plans and on similar NAIC work groups for each change to those plans. Mrs. Burns was an expert witness in a lawsuit that predated the federal adoption of standard Medigap plans. So Bonnie not only has the experience, many years of experience, not just in the state of California, but across the nation and in Washington, D.C. So Ed, Jim, and Bonnie, welcome to the broadcast.
Thank you.
Thank you. Happy to be here.
Now I want to slip into a discussion here about signing up for Medicare. As you can see from this flow chart, the steps needed to sign up for Medicare A and B plan benefits are on the left. You can add an optional Plan D prescription drug plan and a Medicare supplemental plan that is needed to pay part or all of your 20% coinsurance liability that the original Medicare does not cover. You may recall this insurance was once called catastrophic insurance. The alternative path on the right is signing up for a Medicare Part C or private Medicare Advantage plan that must include all A and B benefits as well. But about 70% of Medicare Advantage plans include Plan D drug coverage also. All Medicare Advantage plans require out-of-pocket maximum payments well over $3,000 to over $7,000 a year, depending upon where you live and the cost of healthcare in your respective areas. But Medicare Advantage then covers the balance of the 20% co-insurance liability or catastrophic over and above your out-of-pocket requirement up to $7,400, depending upon where you live. So it should be clear that in order to make a choice between original Medicare or Medicare Advantage plan paths, it's very important to compare the Medicare Advantage out-of-pocket maximum you must pay with the Medigap annual premium. To decide with which part to choose with confidence, you must have personal access to Medigap plan annual premiums by plan type and your zip code. So you'll see from the table here, the plans are listed. There are 10 plans listed across from left to right, A through N. And in the left-hand side, you'll see the benefit column in a green color, listing all of the benefits that are in these standard plans. Plan F is closed to new enrollees. Now, check marks indicate which benefits on the left are offered by plan type across the top. The percentage sign indicates where a plan pays less than 100% of a specific covered benefit. A red X indicates one or more of the Medigap benefits that are not offered by that plan. So obviously, premiums are going to vary by plan type and by state. This table and the diagram we just looked at are in your Medicare and your handbook, and if you don't have one, you can see and download one at medicare.gov, and also contact your SHIP counselor in your state. They can explain the details to you probably better than I could. Now, equipped with what I've said so far, you must select a Medigap plan that fits your needs. Making this choice, making the right choice between original Medicare or Medicare Advantage plan requires your knowledge about your personal health status and habits, your family health history, and personal affordability. Once you choose a Medigap plan, you'll need a list of insurance company Medigap plan premiums for your plan type in your zip code. And this is the real topic that we're going to work into now. Medigap plans and premiums are approved by states and sold directly by insurance companies or by national and local agents. Choosing which path and risks to take, Medicare Advantage or original Medicare with Medigap, requires knowing Medigap premium data. So we started a study in Tennessee regarding our Tennessee Valley Authority chapter. And I'm going to turn it over to Ed now, let him tell you what our study revealed and what we found out about premium access in the state of Tennessee. So Ed, if you will, take it over.
Okay. The NLRN is working on behalf of Tennessee Valley Authority TVA retirees who unknowingly purchased Medicare supplement plans effective January 1, 2017 from a private Medicare exchange called a PME at substantially inflated premiums. This was after TVA terminated its retiree health care plan in the summer of 2016. We are urging the Centers for Medicare and Medicaid Services, CMS, to grant 14,000 seniors a special enrollment period. Rate comparisons clearly reveal that some of the PAE's plans offered to TVA retirees had rates which were significantly higher than plans available directly from insurance companies and from other sales agents. Here you will see the agent, a PME, sold Mutual of Omaha Plan G, the blue bar on the left, to TVA retirees at a premium of $202 a month, $69 a month, or 52% higher than if they had purchased directly from the insurance company. The blue bar on the right. A Cigna Plan G, the orange bar on the left, was sold to TVA retirees at $162 a month, $42 or 35% higher than Cigna's price by the PAE, the orange bar on the right. Shockingly, the PME could have offered the Cigna Plan G for $162 instead of $202 for the Mutual of Omaha plan, a savings of $40 a month. The PME sold plans with a larger commission and did not do what TVA told its retirees it would do, offer them the best market price. While this chart, Plan G covered males age 71, there were similar differences in the premiums for females age 71. A survey of affected TVA retirees was conducted about the premium access problems. Here are just 3 quotes provided by the affected TVA retirees. I was told I had to use one exchange, now via benefits, or lose supplemental insurance benefits. Their plans were limited. I received notice that if I did not use one exchange, my wife's insurance would be canceled. And the third and final quote, they only provided information, but I felt pressured that it was the entity that I had to go through to purchase health insurance. Under Medicare law, if enrollees are presented misleading or false information while selecting a Medigap plan, they could be eligible for a special enrollment period. If granted, retirees would regain their guaranteed issue status, which would provide them a new opportunity to buy a fairly priced Medigap plan without being denied coverage because of pre-existing health conditions. We have asked CMS to investigate why private Medicare exchanges are allowed to push high-priced plans, telling retirees that plans they offer are competitive rates when in this case they weren't. Bonnie, what we discovered with our TVA retirees experience, is that typical of the access and premium variability problems you have encountered in California and other states? And is CMS indifferent to or unwilling to help?
Well, yes, Ted, Medigap premiums can vary significantly within states and even across the country. Many large employers are moving to these private exchanges to provide health care coverage for their employees and their retirees. In some cases, employers pay a stipend to a retiree for their coverage that they obtain through the exchange. In some other cases, an employer plan may provide additional benefits that are separate from the Medigap, such as vision, dental benefits, or in some cases, even a small life insurance benefit. States aren't responsible for requiring agents to cover specific Medigap plans or to disclose all premiums for plans that agents don't carry. CMS also lacks enforcement authority for Medigap premiums. So yes, in general, both states and CMS have been unable to help with this pricing problem. And as you discovered, and I did too recently, I priced a Medigap Plan G in my own zip code for a family member who's 80. The premium for Plan G ranged from $187.75 to $299.32. This person is not in a guaranteed issue situation, so that premium is likely what he would pay if he was accepted for coverage. Again, a wide variation in premiums, even within our state.
Bonnie, access to premium information is piecemeal at best as we look across the United States. And one of the NRLN's proposals is that we ask CMH to create a national database, make that database available very transparently on Medicare.gov. Do you think such a proposal could be achieved without national legislation?
Well, CMS already maintains a database on their website and discloses price ranges in it that may or may not be accurate for a particular individual. I don't know if it would require legislation to compel CMS to expand it and to compel companies to provide real-time updates. or whether it's something that could be accomplished through an administrative process. But my instinct is that it would probably require legislation.
Well, thanks, Ed and Bonnie and Jim. And that dialogue revealed some very important facts. And as a follow-up to the situation in Tennessee with the TVA retirees, I called the state of Tennessee official in charge of approving Medigap plans for sale in Tennessee. And the person I talked with said that she told me it was a buyer's job to investigate, and that Tennessee had no authority to police sellers, to make sure they made buyers aware of pricing for all Plan Gs or any Medigap plan. She said it's buyer beware, and said that we all know sellers sell price plans to get higher commissions. That's a quote from her. To learn how other states with retiree populations dealt with Medigap prices, we wanted to go a step farther than just Tennessee. So I asked Jim Bodenner, who's here with us, the president of our NRLN Florida Villages chapter, if this situation affected Florida Villages retirees as well. And Jim reported good and bad news in Florida. So Jim, why don't you tell us what you found?
Thanks, Bill. Yes, I found some good and some bad news. The good news is, and if we can show the first graphic, you can go to the link that's shown on the screen and click on whatever county you're living in, and a database will come up. And if we can look at the next slide, shows the database that this next screen, you simply fill in your age, your sex, a couple other questions, hit enter, and although you can't read it, it's pretty small, it will bring up a complete list of insurance policies. In this case, it's Plan Gs that are available. If we drill down and look at a little better detail, you can see the shocking difference in premiums. If you look, I sorted the premiums. They range from $283 on the high end to $118 on the low end. That's a difference of 72%. It's pretty striking to see. If you look at, for example, Transamerica Insurance Company's Plan G sells for $165 a month if purchased directly from Transamerica, but if purchased or if it's through an agent, you can get the policy for $202. If you buy it directly from the company, it's $162. The frustrating thing is access, transparency. And what NRLN is proposing is that this data be made available on Medicare.gov so that we can all see it and look at it. I had to call the insurance commissioner in order to find the link to this website. It shouldn't be that difficult to track down premiums in Florida or in any other state.
Jim, that's great, but how can you be sure that the insurance company is a good one if you find one at a lower premium?
Well, that's a great question, Ed. All insurance companies are required to be certified and registered with the respective insurance commissioner in each state. You can call the insurance commissioner, just as I did to find out to locate this database. I've also found out that Google's a pretty good tool too. You can Google the name of the insurance company and get quite a bit of information. Some of the names that you see on the list that I just showed are household names. Some aren't. But Google's a real good tool, or contact the insurance commissioner in your state.
Bonnie, this is Bill. In looking at this, we decided also to take another step, and I'll be interested in your comments. We gathered premium information about Plan G and as well Plan L and N, which seem to be relatively popular with retirees as well, from our regional vice presidents, and it covered the states of Arizona, Colorado, Florida, Iowa, Nebraska, and Washington. So 6 of the 50 states, and I guess if you toss in Tennessee there, we're talking about 7 in total that we will have reviewed here. But we found the same wild differences among premiums that Ed and Jim talked about in Tennessee and Florida. It's just amazing. It's alarming that the gaps between the low and high premium offers for Plan G among these 5 states, reporting on just the G's alone, range from $72 a month to $167 a month. And the smallest gap in any state, any of those states, was 56%, and the largest was 158%. So this is a very, seems to be a very pervasive problem. And Tennessee state executives said they would not add people when I talked with them to help unless the federal government paid for it. So, what have you experienced? What do you think it will take to convince either the federal government or the states to do something different? Will federal legislation, to ask the question again, be required to standardize access?
Well, the variation in prices are a fact of life. As long as companies are meeting the requirements, they can charge what they're charging. Many of the ships use a database tool that's similar to the one that you showed, and it's on the Ship Resource Center website. And it provides pricing information for ship counselors. It has a lot of detailed options. Our California counselors use it with good results, but it may not show all currently available prices by plan type and situation. Applicants always should check with the insurance company before signing up for coverage to make sure that they know what the premium is for what they're buying. Most states don't utilize these tools consistently, and CMS doesn't advertise the availability of ships and the help that they can provide. Many retirees, both those with employer health benefits and those without, may not know about that resource. It's likely that it would require legislation to get all states and all insurance companies to uniformly offer a common service if you want CMS to have a complete, up-to-date pricing and benefits database that's accurate for every beneficiary in every zip code in the country.
Well, Ed and Bonnie and Jim, hey, thanks for all your hard work in putting this together, this information, so we could review it today. I'm sure that our viewers are appreciative. But really, all this information validates our TVA position that denial of open access to Medigap plan premiums is a real barrier, and in their case, extremely costly. They've spent since 2016, now going on 6 years, paying more than they need to pay. And yet they found that even their own state wouldn't help them, and the CMS wouldn't help them. So restricting access is unfair to millions of original Medicare retirees on fixed income that may already have Medigap coverage, but need premium data if they want to investigate switching to another Medigap plan, or out of Medigap to Medicare Advantage, or back from Medicare Advantage if they're eligible to Medigap. And also, don't forget, there are 3 million first-time enrollees, 10,000 a day, that have to make choices that are best for them annually. Their first enrollment time then or when considering switching plans later also. So this is not just a small problem. It's a very confusing element for people in their senior years, and they have to make choices that basically stick with them for the rest of their lives, because it's difficult for a person to actually change an insurance company. It's hard to not believe you're not getting a good deal, but by golly, a lot of them are getting screwed. In January, the CMS emailed me today saying that they have the authority to order a special enrollment period for the 14,000 TVA retirees. They don't have, excuse me, but they're calling it a state matter. So, but they included the name and email address of the Tennessee executive they recommended that I contact. So I talked with the Assistant Commissioner of Commercial Insurance this time, who told me that there had been an investigation, but the TVA case did not meet the, quote, threshold, unquote, requirements for action. I asked to see the requirements and asked for copies of them. He promised to send them to me, but he hasn't done that yet. So, you know, I think we've made our case with facts, the TVA case facts, both CMS and Tennessee absolving themselves of federal and state responsibility to solve the problem, and verification of access problems in Arizona, Colorado, Florida, Iowa, Nebraska, and Washington. One other thing I would mention is I ran through these various states talking with them about the SHIP information, because all of our state people had to go call state SHIP people, is that there was a wide variety of knowledge and skill and just knowledge of the basic system Bonnie mentioned. And training and turnover and so forth is an issue that begs an across-the-board consistent approach. So given that situation, we have asked CMS to take 4 specific requests into consideration, and you'll see it in this visual. 1, declare an automatic special enrollment period for TVA beneficiaries who were provided misleading information by a PME, and that was in 2016. Require that employers disclose to retirees that they are not required to purchase their plans through the PME alone, and that employers and PMEs disclose that Medicare beneficiaries may be able to find a plan in their local market that is less expensive than those offered through the PME. This at least forces an honest approach. Develop and standardize specific instructions that PMEs must follow when providing information to retirees. And last, and probably most important to bring about true consistency, expand the Medigap.gov web pages that list plans registered in states by plan types and their price ranges to fully disclose specific prices for each plan available so that prospective buyers will have full pricing visibility. Rather than tell them that these plans are priced from $85 to $190 in your state, disclose what those prices are by insurance company. So we are also presenting these requests to congressional committees, and we'll be asking you to lobby your elected members of House and Senate to require that insurance companies upload all Medigap plan state filings by plan type, including specific premiums for plans A through N, Medigap plans, that is, A through N, to the CMS national database that we can access by zip code. So we need your help. Make healthcare insurance shopping as easy as buying products online. Watch for action alerts in coming months. Watch our April 13th podcast. We will discuss prescription drug pricing. Then look for Medicare privatization, including Medicare Advantage plan analysis in detail, in much more detail. Then there are accountable care organizations to be looked at. And then in January of 2003, the real blockbuster of all that we have to all be concerned about, the implementation of the final trial for ACO REACH. This is a very, very important topic you will not want to miss. Then there's Social Security and our legislative agenda positions on bills and NRLN proposed bills and other hot topics as they arise. So look for scheduled dates to see new episodes at www.nrln.org and on Facebook, YouTube, and Instagram. Thanks very much for watching, and we'll see you real soon. In order for the NRLN to reach and influence members of Congress on these vital subjects, we need your support. So sign up at nrln.org. Your contact information will be secure and you will receive informative emails, but no junk mail. And most importantly, you will be able to easily send action alert messages to your senators and congressmen that you can edit or create by yourself. So send us emails if you have comments or questions to nrln.org. Phone us at 866-8360-7197 and offer your comments. Suggest topics of interest in income security and healthcare that you would like to learn more about. So now, until next time, you stay safe out there and enjoy your life. And always remember, seniors are special. Thank you very much.